If you think a sudden leak when you laugh, cough, or sneeze is just an inevitable part of getting older, you have been misled. Millions of active seniors in their 60s, 70s, and 80s silently buy pads, pack extra clothing for a quick round of golf, or map out every bathroom between their house and their grandkids' soccer game, assuming their bladder is simply wearing out. But here is the uncomfortable truth. Leakages caused by a simple cough or sneeze are not a sign that your body is failing you, but rather a warning sign that your pelvic support system has lost its structural tension. In almost every single case, it is something you can repair, retrain, and recover without rushing into invasive surgery or living in fear of an embarrassing accident. I am Dr. Carl, a urologist with 16 years of clinical practice, helping men and women restore control and confidence as they age. Today, we are diving into 5 clear signals your bladder gives you when it urgently needs help, along with 5 concrete steps you can take starting right now to fix it. Make sure you stay with me until number 5, because that one involves a common morning habit nearly 80% of retirees get wrong every day, and fixing it often brings noticeable improvement within 48 hours. Before we jump into the list, I want to hear directly from you. Drop a quick comment below telling me your first name, your state, and how long you have been dealing with bladder leaks or sudden urges. I read every single comment, and your stories directly shape the topics I cover in these videos. Let us start with the first signal your bladder gives you, which is leaking when you cough, sneeze, laugh, or pick up something heavy like a suitcase or a bag of fertilizer. In the medical world, we call this stress urinary incontinence, but in plain English, it just means mechanical pressure. Think of your pelvic floor muscles like a strong woven hammock supporting your bladder and pelvic organs. When you cough or sneeze, your diaphragm shoots downward, dramatically increasing the pressure inside your abdomen. If that muscle hammock has lost its elastic bounce, or if the tiny valve surrounding your urethra is weak, that sudden downward pressure forces urine out before the valve has a chance to clamp shut. It is not an infection, and it is not a brain signal problem. It is simply a mechanical seal that needs reinforcement. Studies published in urological literature show that targeted physical training for these pelvic muscles can restore structural support and dramatically reduce leakage in both men and women after 60. To start fixing this week, try the quick lock technique. Right before you feel a sneeze or cough coming on, consciously pull up and squeeze those internal muscles upward, as if you are trying to stop a flow of urine or hold in gas. Doing this right before the pressure hits creates a firm counterpressure that locks the valve shut. If you have severe pelvic pain or recent pelvic surgery, always consult your physician before starting new exercises. The second signal is what I call the key in the lock emergency or sudden urge incontinence. This happens when you feel totally fine all afternoon, but the second you pull into your driveway, put your key in the front door, or step into the bathroom, your bladder contracts violently and gives you 5 seconds to find a toilet. What is actually happening here is a misfire in the nervous system connection between your brain and the bladder muscle, known as the detrusor. Your brain has conditioned itself to associate specific triggers, like the sound of running water or walking through your front door, with urinating. As we get older, nerve signals can become overly sensitive, causing the bladder muscle to spasm aggressively before your bladder is even full. Research from major clinical medical centers indicates that bladder retraining techniques can effectively rewire these nervous system pathways within 6 to 8 weeks. One actionable step you can take starting today is the freeze and squeeze response. When that sudden panic urge strikes, do not run for the bathroom because walking or running increases pressure on the bladder and triggers more spasms. Instead, stop completely still, stand tall or sit down, squeeze your pelvic muscles 5 times quickly, and take 3 deep, slow belly breaths. This sends a calming reflex signal up the spinal cord that tells the bladder muscle to relax, giving you full control to walk calmly to the restroom. Naturally, if you ever experience severe pain or burning alongside sudden urges, bring that up with your doctor promptly to rule out an infection. The third signal is waking up more than twice every night to use the restroom, a condition known as nocturia. While many seniors accept broken sleep as a normal part of getting older, waking up 3 or 4 times a night, leaves you exhausted, elevates blood pressure, and dramatically increases your risk of a fall in the dark. In many cases, the problem is not actually your bladder, but fluid redistribution. During the day, as you sit, walk, or play pickleball, gravity pulls fluid down into your lower legs, ankles, and feet. When you lie flat in bed at night, that accumulated fluid flows back into your bloodstream. Your heart senses the extra blood volume and signals your kidneys to filter out the excess liquid, producing a massive rush of urine while you are trying to sleep. Urological research confirms that gravity-dependent edema is one of the single largest drivers of nighttime urination in adults over 65. A simple action step you can put into practice tonight is elevating your legs above the level of your heart for 30 to 45 minutes in the late afternoon, around 4 or 5 o'clock. Sit in a comfortable recliner or prop your legs up on cushions while reading or watching the news. This forces your body to process that fluid and turn it into urine during the evening hours while you are awake, rather than at 2 o'clock in the morning. Always double-check with your healthcare provider if you notice sudden, severe swelling in your ankles or legs, as that warrants a quick medical review. The fourth signal is a weak stream, hesitation before starting, or feeling like your bladder never truly empties. You sit or stand there waiting for the stream to start, or you finish up, wash your hands, and 10 minutes later feel like you have to go all over again. In men, this is commonly linked to an enlarged prostate compressing the urethra, but in women it is often caused by a fallen bladder, known as a cystocele, or a weakened bladder muscle that cannot generate enough squeezing force. When urine sits in the bladder constantly because it cannot fully empty, it acts like stagnant water in a pond, creating a breeding ground for bacteria and bladder stones. Data from the American Urological Association highlights that incomplete emptying significantly increases the rate of recurrent urinary tract infections in seniors. To tackle this, implement a method called double voiding. When you finish urinating, do not hurry out of the bathroom. Sit or stand comfortably. Relax your abdomen. Gently lean forward with your elbows on your knees for about 30 seconds. Take a deep breath and try to empty your bladder one more time. You will often be surprised by how much extra fluid comes out simply by changing your posture and taking that extra moment. As always, if you ever find yourself completely unable to pass urine, seek immediate medical attention. Let us pause for just 5 seconds right here. If this information is making sense and helping you connect the dots about your own health, please hit that like button right now. It takes 1 second, but it tells the algorithm to share this video with thousands of other seniors who might be quietly struggling with these exact issues. And drop a comment telling me, do you find yourself getting up more during the night, or is leakage during the day your primary frustration? Moving on to our fifth signal. And remember, this is the morning habit I warned you about earlier. It is constant irritation, burning without an infection, or feeling an urge every 45 minutes despite only passing a few drops. The main culprit here is dietary bladder irritants, and coffee is the absolute king of them. Many active retirees love starting their day with 2 or 3 large cups of hot coffee, followed perhaps by iced tea in the afternoon or a glass of citrus juice with breakfast. What you might not realize is that caffeine is both a direct chemical irritant to the lining of your bladder and a rapid stimulant to the bladder muscle. Furthermore, highly acidic beverages drop the pH of your urine, making it bite like salt on an open scrape inside your bladder wall. Clinical reviews consistently show that eliminating or reducing dietary irritants significantly decreases urgency and frequency in older adults. Your action step this week is not to abandon your joy, but to smart swap. Try cutting your morning coffee back by just 1 cup, or switch to a low-acid, decaffeinated roast. More importantly, always drink a full glass of plain room-temperature water right alongside your morning coffee to dilute the acidity before it ever reaches your bladder. As a soft reminder, never make drastic diet changes if you are managing complex kidney conditions without checking in with your nephrologist or primary physician. Your clear action step for this week is to maintain a steady, moderate intake of plain water distributed evenly throughout the day, aiming for small sips every hour rather than chugging large glasses all at once. Stop heavy liquid intake about 2 to 3 hours before bedtime to protect your sleep, but never dehydrate yourself during the daylight hours. If you take fluid restriction instructions from a cardiologist for heart failure or kidney disease, always follow your doctor's exact guidance on total daily fluid volume. To show you how these pieces fit together in real life, let me tell you about a patient of mine named Robert. Robert is a 72-year-old retired civil engineer who spends his winters down in Naples, Florida. When Robert first walked into my office, he was frustrated and deeply anxious. He loved playing 18 holes of golf 3 times a week with his neighbors, but over the previous year, he found himself constantly worrying about leaking every time he drove the ball off the tee or had a heavy coughing fit on the fairway. He had started restricting his water, drinking 3 cups of dark coffee every morning to stay alert despite poor sleep, and waking up 4 times every night to use the bathroom. He was convinced his active retirement was coming to an end and that he was facing major surgery. We made 4 specific adjustments. We adjusted his morning coffee routine and paired it with water, introduced the late afternoon leg elevation for 45 minutes while he watched the stock market news, taught him the quick lock squeeze before he swung his golf club or coughed, and put a footstool in his bathroom to prevent straining. When Robert came back to see me for his 12-week follow-up, his nighttime wake-ups had dropped from 4 times down to just once. His daytime leaks on the golf course had completely stopped, and his confidence was fully restored, all without a single prescription drug or surgical procedure. If you are ready to take back control of your bladder starting tonight, here is your 5-step plan to begin right away. First, elevate your legs above your heart for 45 minutes around 4 or 5 o'clock this afternoon to clear accumulated fluid before you go to bed. Second, practice the quick lock technique. Contract and lift your pelvic muscles right before you cough, sneeze, laugh, or lift something heavy. Third, adjust your morning beverage routine by drinking a full glass of water alongside your coffee, and consider trying a low-acid or decaf option. Fourth, use the freeze and squeeze method whenever a sudden emergency urge strikes. Stand completely still, take 3 deep belly breaths, and perform 5 quick pelvic squeezes to quiet the bladder muscle before walking to the restroom. Fifth, place a small footstool in your bathroom to elevate your knees while sitting, eliminating abdominal straining during daily bowel movements. Taking care of your bladder support system is essential, but there is another common bodily habit that quietly destroys bladder control from the inside out, and almost no one over 60 realizes they are doing it every evening. In my next video, I am revealing the one popular bedtime snack that acts like a catalyst for middle-of-the-night bladder spasms, and why cutting it out for just 3 days can give you your first full night of uninterrupted sleep in years. I am Dr. Carl. Stay well, keep active, and I will see you right there in the next video.